Okay, this video is about EKG/ECG lead placement. Keep in mind that most people call them EKGs. ECGs means the same thing. It stands for electrocardiogram. Getting your patient ready for the ECG, you need to have a private place to do it and instruct the patient to undress from the waist up. You can use a gown and make sure they put the gown on open to the front because we're going to need to have access to the chest area for the lead placement. And what you're going to need is a ECG machine. You're going to need some leads, some electrodes, and the machine will have these clips for the electrodes. So this is called a 12-lead ECG. And there are 10 stickers because 2 of the leads don't have physical leads. 2 of the leads are interpretation of some of the other leads. So what I usually do is I'll greet the patient, go out to the waiting room, call them back using their first name. When we get back to the patient care area, I'll verify their last name, their date of birth, repeat their first name, make sure I have the right patient. Check the orders. You need to have a table. It is okay to do these in a chair. If you have a patient that's not mobile or can't be moved and they're in a wheelchair, that's okay. They can do this seated as well. As long as they're relaxed and they're not moving around during the procedure. So I've instructed my patient to undress from the waist up, put the gown on, open to the front, and I'll step out of the room. Generally speaking, have them take everything off on the waist up. And then most patients are fine with it, and the vast majority of patients are fine with that. And when the gown's open to the front, the gown can cover the breasts, so that's okay. But this video is about lead placement. So now your patient's ready, lying down on the table, with the gown open to the front. So what we have with these 10 leads are 4 limb leads and 6 chest leads, which are V leads. They start with the letter V. So we'll start with the limb lead. So limb lead placement is a lot more forgiving and it's a lot easier than the chest leads. The general rule about all of these leads is that you want to have them over soft tissue, not over bone. The bone inhibits the electrical conduction and it doesn't provide you with a good picture. So you want to make sure it's over soft tissue. And if you have a patient that's really hairy, you're going to need to have a clipper and you're going to need to shave those portions. If a patient's skin's really oily, you can clean it up with the alcohol wipe and then let it dry off so that they stick, because you need to have these adhering to the skin. You do a lot of these. It's a good idea to have a rechargeable clipper with changeable heads on it, and that makes it really easy to shave the hair off. So the limb leads for regular ECGs, we have a right arm, left arm, a right leg, and a left leg lead. So I'm making sure my patient's comfortable and relaxed. Wash my hands, glove up. Mostly the gloves are because these things are so sticky. You don't want to get a lot of that goo on your hands, especially if you're doing a lot of these. So the limb leads, the arm leads, for a regular ECG is just over the soft part of the tissue. Usually I put it up on the deltoid. This guy doesn't have any arms. For stress tests, the lead placement for the limb leads is a little bit different because the limbs are moving around during the stress test. So for a stress test, you might see that the limb leads are up here underneath the clavicle, and the leg leads are in the upper quadrant. But for the vast majority of ECGs, if you're not working in a stress lab, then you're going to have them on the deltoids or on the soft part of the arms here. So that's my right arm, so it's my patient's right side, left arm lead. And then the leg leads, I like to put on, just pull the patient's pant leg up a little bit and put it on the soft part of their calf on the inside. If you have someone that has really poor circulation in their legs, you can put it on the abdomen. Or if they're a double amputee or something like that, you can put it on the abdomen down here. So I've got my right arm, my left arm, my right leg, left leg leads. And now I need to find the placement for the V leads. And the way I find it is, it's V1 through V6. So it's going to be 1, 2, 3, 4, 5, 6. And there's a specific placement of these in order to make sure that we're over the intercostal spaces and not over the ribs. The general map of this is, if you start with the sternal notch, and then go down, you'll find this bump here. It's called the angle of Lewis, the angle of Louis. And then right to the side of that, if you find that intercostal space, that's the second intercostal space. For V1, we want to have it over the fourth intercostal space. So I'm just going to go down 2 from there. If you can't feel the intercostal spaces, 2 fingers is a general guide. But so I've got my angle here. So there's my second, third, fourth is actually down. So here's my fourth intercostal space. So my V1 goes just to the right of the sternum over the fourth intercostal space. V2 goes directly across on the other side. So just to the left of the sternum over the fourth intercostal space. The next one I want to put down is V4. V4 goes over the fifth intercostal space along the mid-clavicular line. So you take the collarbone, the clavicle, and divide it in 2 and go from the center and straight down and then find that fifth intercostal space. So that's the next space below the 4. V3 goes just right in between 2 and 4. Like that. The next one to put down is V6. V6 goes on the same parallel line with V4 along the mid-axillary line. So these are the axillary lines. You have an anterior axillary line and a mid-axillary line. You want to put V6 along the mid-axillary line along the same parallel as V4. You don't have to move your patient like this, but I'm just doing this to show you. And then V5 goes right between V4 and V6 along the anterior axillary line. Like that. And that's your lead placement. Make sure your machine is on. And clip on your electrodes. With these guys, you want to make sure they're clean so that you get a good signal. Most machines have these in there. You can change them out. And make sure that is clean in there to make good contact. Since I've been running these a lot, and I can't wait for, the company rep or whoever to come out and clean them, I usually clean them myself and try to keep them clean. These things easily get tangled. If you don't get these right, the machine will tell you. So if you print out your ECG and it says the limb leads are crossed or whatever, right arm, left arm, and left leg, so it says on there. One other thing too is if you have a patient that's getting ready for a procedure, we do a lot of ECGs on people that are having day surgery or whatever. They might have a lot of lines and equipment already hooked up to them. You can turn these tabs either way, it doesn't matter. So if you have to run the leads this way, like that, that's okay too. But if they're just getting ECG, the easiest way is to point them down. Okay, so I got V1 through 6 here, so this one's 4. It doesn't matter what order you hook them up in. What matters is your lead placement. This one's V2. V5. V1. sure that's in that clip. 3 and V6. So things you're going to need to know. V1, fourth intercostal space just to the right of the sternum. V2, fourth intercostal space just to the left of the sternum. V3, directly between 2 and 4. V4, fifth intercostal space, mid-clavicular line. V5, along the same parallel with V4 on the anterior axillary line. And V6 on the same parallel with V4 and 5 on the mid-axillary line. So I'm going to run my ECG now. My machine's on. All my leads are hooked up. I'm going to run it. And it's going to take maybe a minute. At this point, I want to make sure my patient's not moving, that they're still. I want to make sure that there isn't any cell phone that's sending and receiving data near these leads. And I want to know, and I'll document this, if they have a pacemaker, a defibrillator, or a neurostimulator. So I get my printout and I can take a look, make sure that it's giving me a good picture, make sure I don't have wandering lines, make sure I don't have interference. The machine will usually give me a basic interpretation, and I'll show this to the provider before I let the patient go for the day. It's really important if you catch something that's happening with their heart, to make sure they don't leave the clinic. Make sure the provider sees this before you discharge the patient. Unhooking, just taking these off. Don't whack your patient, put them in the face. And then some of these are stickier than others. You might need to use some kind of adhesive remover or something sometimes for patients that are really sensitive. Don't tear off their skin, don't go, but don't go really slow either. And at this point, I'll instruct the patient. They can get dressed, they can get their things ready, but to please wait in the waiting room until I come back and let you know if you can go. That's it. That's the ECG hookup.